My name is Dr. Andrew Michaels, and I see they have invited you into St. Elizabeth's Medical Center for observation. Okay. I believe you have some phobias that have been making your life difficult. You're finding it hard to go out and live a normal life during the day. Is that true? Okay. You can only go out at night? That's the only time you feel safe. Well, there could be some psychosis here, but we want to rule out any physical problems. All right? Yes. So to do that, we're going to perform a very complete cranial nerve exam. And hopefully we can rule out any physical manifestations to why you feel the need not to go outside. I'm sorry, my breath stinks? No, I don't consider that rude at all. To have a good doctor-patient relationship, I certainly wouldn't want to offend you with my breath. I'll just have a little bit of this mint to cover that up. I do apologize. I just came from lunch, and I had some garlic hummus with some chips. I ate kind of late, and I was in a hurry, so just a little garlic hummus. I can see you're not a fan of that. That's interesting. But I'm glad they invited you in to our medical center to iron this out. Yes, the Archdiocese runs this hospital, and of course, it's a bright sunny day. I will make sure you feel more comfortable. Let's turn off some of these lights. Okay. Definitely, if the light is causing you too much trouble, we wouldn't want you to feel uncomfortable. So I think dimming that helps a little bit. Don't you think? Well, I've got the shade over the window as you requested to keep the sunlight in. There's just a little sliver of the sun coming in right now, as you can see. I hope you don't mind. I think it'll be okay for our purposes today. All right, good. Okay, just relax. And the first thing we want to do is we want to test your sense of smell. Now, I have some odors. And, well, let's make sure that we have the correct problem here. Here's the first one. I'm going to shake it up a little bit and cover up this side of your nose and give it a smell. Okay. That's right. I knew you'd get that, garlic. And it's very offensive to you. Well, don't worry. I'll put that as far away. I'll cap it. And we'll stopper that up and get another one. Okay. Now this next smell. Shake it up. That's... Cover up this nostril. That's right, rose petals. And you find that offensive too. Okay. All right. And this third smell, it's very common. Let me cap that. All right, now cover up the other nostril again. All right. What are you? That's right, mustard seed. Oh, that's very compelling to you, mustard. Okay. No, I don't have any mustard seeds. So you have a penchant or a desire to count mustard seeds? Just let me write that down. Okay, for instance, I just had some microwave popcorn. A friend shared it, and we poured it in a bowl, and I was noticing how many kernels were unpopped in the bottom of the bowl. Now, just telling you this, do you feel the need or desire to count those corn kernel seeds in the bottom of that bowl? You do, okay. No, okay. I don't think it's anything to be alarmed about right now. We're just starting. I don't believe you have a deviated septum, but before we start the optic nerve test, I wanted to address something. Your eyes are very red, and that in itself is not a problem, but you look very full in the face. Hang on a minute. I'm just getting a piece of paper here. You look very, I should say, bloated. Your skin has a very pale color to it, and yet your eyes look like you haven't been out in the sun. So you have some features in your skin and body that appear plump and healthy, and yet your eyes deceive me and make me think that you haven't been out in the sun in quite a long time. Okay. You haven't been out in the sun in quite a long time. Okay. When did this occur? Okay. May I see that? Let me just observe that spot. No, there's no visible. I'll get some gloves on here to get a closer look. Hope you don't mind. Just give me a second. I don't see any visible markings. You say you were bitten. Coming out of work one night by a bat or a rat? I'm not seeing anything. Just give me a minute. Let me look at that again. No. I don't see any marks here. You look completely normal. This might have to do with the psychosis that we feel that you might be experiencing. So let's go further with the test. And you feel like your eyes are very accurate? Okay. All right. Okay, let's move on to the optical section of our test. And what I'd like you to do is cover up your right eye and read this small religious pamphlet that I have here. Ooh. What happened there? Are you okay? Oh, that looks like that hurt. I don't think there was any food residue from my lunch on it. I'll tell you what, there's nothing on the paper. Okay, I'll tell you what, just cover up your eye and we'll try the other hand. Maybe there was, I don't know, just cover up your other eye and use this hand here. Psst. Oh. Okay, can I see your fingers? Oh, that looks like that hurts. Maybe I should put some cream on that. I have some silver eye dye right here. Just let me, no? You don't want any of that on you? Oh, okay. Looks like a good sunburn on you. I'll tell you what, I'll just try and hold the pamphlet up and you can try to read it. Okay, you're definitely having problems seeing it properly. Okay. All right. Okay. Let's just skip that part of the test now. What I have next is a light, and I'm gonna just shine it at your eyes. It's not very bright. It's blinding. Okay. We do have a light aversion problem, but I want you to try the best you can. I'm going to take my pen, and I want you to cover up this eye, and I want you to follow me wiggling this pen. Okay, here, 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 here. Okay, might work better for you. And here. Okay. Now cover up the other eye, and let's perform that test again. So here, 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 here. Okay. Very good. Thank you very much. All right. Just a second. Now just be calm. Nothing's wrong. Okay. I'm gonna try a little smaller light. It's not quite as strong. And I'm just gonna, real briefly, kind of shade yourself away. Now, how's that? Okay. All right. There. Make sure. Tell me you can see it. All right. All right. That made your eyes water. Let me get in closer for just a second here. I know. Just try to relax. Hold still. Okay. All right. Oh, it's making the blood vessels flare. Now we won't do that again. Cause no harm. All right. That's not working so well. All right. I want to try this again, and we're gonna try something again. I want you to look straight in my nose, and just follow this wiggling pen. Keep looking at my nose. Keep looking. All right. Okay, your eyes are like following everything perfectly. Now, I want to do something now. I want you to do the same test. I'm just going to hold the light up. We're going to point it away from you, but I'm going to wiggle it. Now try and do the same thing. Look at that. I'm pointing it away from you. But just that little, it's that bright. Okay. Just even pointing it away from you like that, it's like a flare. Huh. That's amazing. Your heartbeat seems very elevated. Could you lean in towards me and let's let me just check you out here. It's all right. It's okay. It's all right. Okay. No. It's all right. Okay. I'm gonna try something here. I would like you to let me see what you see in this mirror right now. Okay? Real quick, this little tiny observation mirror. And you tell me what you see. Alright, okay. Alright, let's try that again. Do you see anything in that observation mirror? Okay. You don't see anything? Okay. Okay, it's all right. No. Everything, shit happens, Everything's fine. We here at the St. E's medical facilities always take our patients very seriously, and there's nothing to be alerted about or excited about, or I think you're just fine. I think you should just calm down, okay? And I think we'll go on to the next step of the test now. Oh Lord, it's a touch test, okay? Just calm down. Sure, everything's fine. No, I didn't push that alarm button. No, everything's just me and you, your friend Dr. Andrew Michaels. We're doing, my demeanor is fine. You need to calm down. Okay, relax. I'm going to take this sharp stick, but it's only sharp on one side, see? Okay, and it's a dull on the other side, see? And we're going to do a touch test on your different parts of your face, see? And it won't hurt. And you're going to let me know if you feel anything. Okay? Feel that? Okay. Feel that? Okay. All right. And over here. Okay. Just real lightly. You feel that? Okay. Now, same thing. Very lightly, I'm going to check for the nerves with the sharp point. Now, it's very light. Will not hurt. Will not penetrate. All right? Now just hold still. Oh, okay, now just hold still. I'm telling you, it won't hurt. Okay. I'm not going to penetrate. Yes, it is. It is. How did you know what the wood was made out of? It is. Well, that's amazing. How could you tell what kind of wood this was made out of? No, it's not pine. No, it's rosewood. That's incredible that you knew. Okay, well, I think we've got enough of that. Okay, just a second. I just got to write a couple things down here. Okay. Now, let's just move on to the second part of the test. Okay. And I'm just going to check your motor reflexes. I need you to just let me gently slide my hands down your mandible. Can you open up your lips a little bit there? Okay. No, I don't see anything unusual. Oh, you look perfectly fine. Okay. Could you open up your mouth and we'll just use a small tongue depressor. And we're just going to inspect the inside of your mouth and your tongue. So just let me push your tongue to one side. All right. And your tongue to the other side. Oh my. Yeah, those are some. And underneath your tongue. Okay, let's just take a real quick. Close your eyes. This will only take a second. Very little light. Close your eyes. And I just want to look down your throat real quick. Okay. Yeah. No, your breath does not smell of carrion or anything. Your breath smells very nice. Absolutely no problem. You definitely have pronounced canines here. Did you notice that right away? Are you on a liquid diet? Yeah, I can tell. Yeah. there's a lot of yes coming out, but we're on the same page. All right. We're going to check for Bell's palsy. And what we're going to do there is I need you to raise your eyebrows. Yeah, like that, like that. Like, yeah, like that. There you go. Okay, and frown for me. Okay. All right. And close both eyes tightly. See if I can open them. Okay. Close them. Keep them closed. Okay. Keep your eyes closed. Keep your eyes closed. I'm doing the test right now. Okay. Keep your eyes closed. No. There's nobody in the room. Just me. Okay. All right. Now you can open your eyes now. I just gotta. No, it's really hot in here. I agree with you. It's really hot. Okay, now show both your upper and lower teeth like this, like, like that. Yeah, just like that. Yeah. Yeah. Okay. No, he's just walking by. That guy's not coming in here. Okay, and then smile like, like, okay, and puff out both cheeks. Like that. Okay. All right. Okay. Sure. Let's see. I'm gonna whisper in your ear now, and this is not gonna. I'm gonna just try something here. I need you to just relax. Don't make any sudden moves. Okay. I'm gonna whisper in your ear. The Lord is my shepherd; I shall not. Oh, what? No, I was just. It was the first thing that come to my mind. Okay. Just lean forward and we'll try it again here. First thing comes to mind. This is blood of my blood. No. Communion. I got it on my mind. Communion, blood. I don't know why I keep saying blood. I hope you're totally okay with that. Okay. Your hearing's great. I mean, I know you can hear, sure, that guy down the hall talking about you. Yeah, well, we're just concerned about your well-being and your safety. He's not saying anything about you in a negative way. I prefer if you just sit there. Okay, now we're going to try something here. This might be a little difficult for you. I need you to do like what we call vampire cough. Oh Lord, that wasn't funny. But anyway, we want to shrug your shoulders and, like this, like, and then this way. You ever done something like that? Like, like that? Okay. Shrug your shoulders when you're doing it. Okay. You look great to me. And we're going to check some reflexes here. If you want, you can stand up. I can sit here. I can sit over here. This is just a decoration in the room. I'm going to put it right here beside me. This right here. I'm going to put it right here. It's just a little, thanks for stopping by St. Elizabeth's Hospital. Okay, and it's just a little, for the Harvest Festival. It's got little corn kernels there. Look, you want to count those? You can't look at it. It's too bright. Okay, this is bright to you. Oh, it's like you can't even tell what it is. It's burning your eyes. Okay, well, we're going to put that right here between us. That's right. You can just, over here, like, I'm going to just put it right here. And you can go over there in the other side of the room, and I'm gonna just use this real long stick to test some of your reflexes. If you want to sit down on that stool over there on the other side of the room, okay, and yeah, okay, and I have this spray here. to fluorescence the room up a little bit with, just a little. I'm just gonna put that back down because I think you should sit down. Okay, all right. Okay, I'll move the cross, but you have to sit down. Okay, all right. We're gonna move the cross. See, over here, the station of the cross is moving over here. All right, we're gonna put a little piece of paper over it so he can't see it. Okay, all right. Okay, and we're gonna test some reflexes. So cross your knee, and I'm just gonna, Okay, your knee's not moving. Let's cross legs and do the other one. All right. All right. You have no reflexes whatsoever. Let me check some other parts of your ankle. No, you have no reflexes. And I think you already know that you have no heartbeat. You have an aversion to light. You have pronounced canines. Your eyes are bloodshot. You've been on a liquid diet for several weeks now. You have an extreme aversion to light. When I use my mirror, you see nothing. There's nothing in my mirror sitting on the other side of the room. You can tell this little tiny skewer that I use for checking nerves is rosewood, and you have a horrible aversion to garlic, which I'm going to keep right here in front of me. Here's the garlic. So, yeah. Do you think you know what happened? Are you kind of starting to become aware of the problem? I think we can probably end this cranial nerve exam. At this point, I could try some hypnosis. Maybe we could just sit still. Okay. All right. Nobody's going to harm you. Okay. I just got the holy water here, sprayer, that the priests use. They keep it in the room, a little communion kit. That's all that is. It's just there's a wafer and some holy water and a little tiny bit of that and the oils. It's just a priest kit. I didn't even know it was in there, but you've managed to bring it to my attention. I'll just keep that holy water right here in front of me with the garlic. So, if you have any problems, I'm just going to squeeze those bottles really hard and pop the tops. But nothing's going to happen because you and I have a good decorum here. Nobody's coming in the room. I don't know why. And I just need you to sit still for a few more seconds. Maybe we should try some hypnosis therapy. Yes. Oh, yes. Yes. Maybe we can get to the bottom of this with some hypnosis now. This is really good. You just have to stare at an item, concentrate on it, and I have this little crucifix right here. I'll swing it across your face here. Oh yeah, you don't like that. All right, that's not going to work. Okay, even if I swing it, okay, it's like a big ball of light. Okay, it hurts. Okay, well, I'm just going to put that, like, it won't fit around my neck because I've got a big, I'm like a gorilla, but I'm going to hang that, well, I'm just going to lay that over here. Okay, let's just put that aside because I'm going to pee my pants here in a second. Yeah, I never said so much in my whole life, but I just want you to be as comfortable as possible because I can't believe nobody's coming in here. Sure. Yeah. Okay, so I've got this stopwatch. Could you look at that? Yeah. All right. And there you go. And we're going to try a little bit of hypnosis. Okay. You're feeling very tired. Focus on the watch. Focus on the watch. Do not look at the blood bag behind the watch. Look upon the bright, shiny watch. Concentrate. You feel your eyes getting sleepy and sleepier. You feel so tired. You want to rest. You've been up all night. It's a very bright sunny day out, and you need to crawl up underneath the blankets in that bed and rest. Oh yeah, I'm gonna go over here while you sleep. That's right. You feel your eyes are getting heavier and heavier, and you fall asleep, the sleep of the dead. You do not want to drink the blood. No, you want to sleep. Just stay still, don't move, or I'm gonna pour holy water all over your trance-like state body. There you go. Okay. Sleep now. At the count of 3, backwards, you're going to be completely asleep. 3, eyes getting heavier. 2, you feel yourself drifting off to slumber. 1, you're counting sheep. Plump, juicy, blood-filled sheep in your sleep. In your sleep. Sleep. Thank you, Jesus.